Hello and welcome to Lecture 3 on Psychological Disorders. So now we're going to look at some of the assessment methods used for psychological disorders. We're just doing a little intro to this, and then we'll talk a lot more about assessment in Chapter 15. So, trying to determine if someone has a mental disorder or not is not nearly as straightforward as it is for most other medical diagnoses. And that's actually one of the big criticisms of the anti-psychiatric movement, is that, well, there's no medical testing. And that's not so much true, but no, we can't take a blood test and diagnose schizophrenia or bipolar disorder or personality disorders. When physicians are diagnosing other types of medical diagnoses or disorders, they've got a lot of lab work they can rely on. They can do, x-rays, MRIs, fMRIs, CAT scans, PET scans, EEGs. There's so many tests that they can use that can give them very objective evidence. And in psychology, it's not quite as simple because humans are complicated. The human mind is complicated. And, that's where the DSM-5 is so helpful, is it does give us an objective standard of, okay, here's what every patient, client diagnosed with this disorder must demonstrate. And it doesn't just tell us the symptoms for each diagnosis. It tells us how to identify those symptoms. So, for example, sometimes, people with bipolar disorder, especially bipolar 1, when they get manic, they might hallucinate. And one of the criteria in the DSM-5 is that the clinician must confirm that the hallucinations or the psychotic state is not due to drug use. And so I think that the DSM-5 does a good job of leading physicians and psychologists through the diagnostic process and through the assessment process. Now, the assessment process helps us get to working through the diagnostic criteria presented in the DSM-5. So assessment in psychology is the examination of a person's cognitive, behavioral, and or emotional functioning to diagnose possible psychological disorders. This process often includes self-report. So the first thing that a clinician is going to do is they're going to take a history. They're going to interview the client or the patient and get a self-report history, and then also talk to that person about the symptoms, what brought you into the office, what are the symptoms you're experiencing, what are your thoughts about why this is happening, things of that nature. And there's all kinds of psychological tests that we have. We rely on in-person observation, and sometimes we do neuropsychological testing, and there's a whole lot of different kinds of neuropsychological testing, but sometimes it's very easy, such as, when diagnosing or when exploring the idea that maybe a client has dementia or is, starting to develop dementia. A very basic neuropsychological test is to ask, is to list 5 words. So you tell them, I'm going to tell you 5 words, and then in a few minutes, I'm going to ask you for those words again. And I want you to remember those 5 words. Then you list the 5 words. 5 minutes later, you ask them to tell you what those 5 words were. Well, if someone's developing dementia, they're not going to do well on that. Now, my mom, she does not have dementia. She's 76, and she had her cognitive testing, because it's pretty standard now with when you're doing your yearly physical. and she got 4 out of the 5 right. That's just fine. It's when someone can only get 1, maybe 2 words right. Now, that doesn't seem like a really, you're like, is that really a neuropsychological test? It is. It's very simple, but it also tells us a lot about that person's neurological system. Now, in the neuropsychological method, the client might perform actions such as copying a picture, drawing a design from memory. They might sort cards based on shape or size or color, organize blocks, finger tapping, toe tapping. There are so many different clever little neuropsychological tests that have been created. Now, you're not looking at is the client performing poorly on all of this test. You're looking at what are they doing well on and what aren't they performing well on. And often this neuropsychological testing gives you indications of, okay, maybe we need to start looking at this specific brain region. You know, we know that memory is very much a whole brain activity, but we also know that, dementia is going to really attack the limbic system. So if someone is doing really poorly on tests, on memory tests, that's going to be something we're going to want to look at. And often medical exams should be performed. And I like to tell students this because there are plenty of medical diagnoses that have psychological symptoms. One is hypothyroidism. A common symptom of hypothyroidism is depression and anxiety. And so sometimes it's a good idea for a client or a patient to have their thyroid levels checked to try to eliminate one possible cause for the depressive symptoms or the anxiety symptoms that might not be due to actually having the psychological disorder of depression or anxiety, that it's actually a symptom of hypothyroidism that resolves once hypothyroidism is treated. And there's all kinds of diagnoses that are like this. Chronic pain, people with chronic migraines get a lot of depression and anxiety. It's not unusual for psychiatric symptoms to come along with other medical diagnoses. And I think often when a person's general practitioner would ask if there's some psychological symptoms going on with whatever medical issue that they're having, people often hear their doctor is saying it's all in your head, and it's absolutely not what they're saying. They're trying to figure out, okay, are there some psychological symptoms going along with the other medical symptoms being experienced by the patient? So you've got self-reports, observations, interviews, put together your assessment, you get your diagnosis, treatment, and ongoing assessment is critical. You can't just stop with treatment because you need to see how treatment goes. And so you continue assessing throughout the treatment plan. The primary goal of assessment is to make a diagnosis so that the appropriate treatment can be provided. Treating psychological disorders is difficult, and some disorders are much more difficult to treat than others. But it really comes down to making a clear, concise diagnosis. Now, the prognosis for the client or the patient often depends on the specific psychological disorder that they're diagnosed with. Some psychological disorders respond very well to treatment. Some of the more complicated ones, like schizophrenia, the severity of symptoms varies from patient to patient, but it is a very, very difficult disorder to treat. And so trying to come up with a prognosis right away is just not possible with the more complicated disorders. Ongoing assessment helps mental health workers understand whether specific situations might cause some worsening of the disorder. It helps them determine whether or not progress is being made throughout treatment, or is a treatment working? Is it actually hindering, is a specific type of treatment hindering that patient's progress or that client's progress? And other factors that might help in understanding unique aspects of a given case. Every client is different, and every case of depression manifests itself differently. Yes, there's a whole list of symptoms that must be met, or criteria that must be met for a client or patient to be diagnosed with depression. But how that depression manifests differs from person to person because people are complicated. So a key question is whether psychological assessments provide information that is useful for treating psychological disorders. Some types of assessment are very helpful, and some are not so much. And that's where research really becomes important. And clinicians do a lot of continuing education so that they stay current with the most recent research. So some of the popular methods of assessment, like projective tests, are not shown to be very helpful when predicting the kinds of treatment that are used. So there's a projective test called the TAT, where the therapist will show you a picture. It's just like a hand-drawn, regular life, everyday life image, and you tell a story about what's happening in that photo or that sketch. And then the therapist is looking for underlying themes within your explanation for each of these sketches. These are not helpful when it comes to predicting the kinds of treatments that will be useful for that client. We don't need to throw the TAT out completely. There are some, it can be helpful. It's not helpful for diagnostic purposes anymore. It used to be considered very, very helpful, but current research is saying we need to go with other, more objective testing. And individual clinicians often choose the assessment procedures that are based on their own subjective beliefs and training, rather than scientific studies. But clinicians are challenged to do better with this. So they're often forced to explain, okay, why are you choosing this test instead of this other test? And they need to be able to say that, to explain why they're using that specific test with that specific client. So we try to go with an evidence-based assessment approach. And this is an approach to clinical evaluation in which research guides evaluation of psychopathology. The selection of appropriate psychological tests and neuropsychological methods, and the use of critical thinking in making a diagnosis. There has been a very, very strong push to make psychology and psychiatry evidence-based. And I think we're doing better with that as a field. I really, really do. This evidence-based assessment approach could indicate that people found to be depressed should also be assessed for comorbid conditions such as substance abuse or anxiety disorders. Okay. Thank you. We'll end right there.